Is not recorded. Mr. Veazey votes aye. Ms. Fedorchak is not recorded. Ms. Fedorchak votes no. So you got 24 noes. Mr. Chairman, on that vote, there were 24 ayes and 29 noes.
Amendment is not agreed to. What, Ms. Schreier? Dr. Schreier? What purpose is the gentlelady from Washington seek recognition?
Mr. Chairman, I have an amendment at the desk.
The clerk, do you have the amendment?
Amendment 128.
The clerk will report.
Amendment offered by Ms. Schreier. At the end of the following section, requirements with respect to cost sharing for
Without objection, the reading of the amendment is dispensed with, and the gentlelady is recognized for 5 minutes in support of the amendment.
Thank you, Mr. Chairman. Republicans are here again trying to convince us that this bill, their so-called big, beautiful bill, will save the taxpayers money. But of course it won't, as we've already discussed multiple times over the past almost 24 hours. It will kick 13.7 million Americans off their insurance, and will use those savings to pay for a giant tax credit for billionaires. But there are ways we can help people who lose their insurance, and also those with private insurance who see their own costs rise because of this. And as someone with type 1 diabetes who relies on my health insurance to access affordable insulin, I would love to focus on that. As mentioned, we're gonna see healthcare costs increase dramatically for all of us if we boot 13.7 million people off their Medicaid insurance. Those kicked off Medicaid will still get care, of course, but they'll be sicker, they'll be treated in the emergency room, the care will be more complicated, more expensive, and since they can't pay for it, all of us will make up that difference. So our insurance rates are going to go up. Now think about this in the narrow context of diabetes. I read part of this letter from an endocrinologist in Wenatchee, Washington last night. She talks about how she worked as an endocrinologist before the Affordable Care Act and after. And what she saw after the Affordable Care Act was enacted is that she had many more new patients with type 1 diabetes just coming out of the woodworks. And these were not new diagnoses. They were just people who had been getting by for years by purchasing over-the-counter insulin, syringes, NPH, and regular, which is what I used back in the 1980s. They had just been getting by, and because they didn't have all the supplies they needed and the technology, they already had developed permanent complications of diabetes. So now with the Affordable Care Act, they finally had insurance for the first time in their adult lives, and she could get them on treatment with better insulins, newer insulins, insulin pumps, continuous glucose sensors. And then she talks also about how now she also diagnoses adult new type 1, people with type 1 diabetes, also most on Medicaid, and those patients are getting such great care because they can start right off with the newest insulins, the insulin pumps, the continuous glucose monitors, and this allows for optimal care. So of course I worry about them losing their care, but the bottom line for all of us is that insulin is still really expensive. So as we talk about saving money and using dollars effectively, we first need to think about the affordability of insulin, insulin pumps, glucose monitors, and how much that costs, so the upfront costs, versus having to pay for much more expensive treatment of complications later. And it's not just the medical costs, it's also that many people with these severe complications will not be able to work. My amendment is simple. It would cap the cost of insulin at $35 for those with private health insurance. We were so successful when we placed a cap on insulin prices for Medicare recipients a few years ago. I mean, it was life-changing and life-saving, and that is not an overstatement. So if my Republican colleagues are gonna take healthcare away from millions of people and raise costs for the rest of us who are not on Medicaid, the least they can do is agree with us that we should lower the cost of insulin for everyday Americans. And I urge everyone, including my Republican colleagues, to vote yes on this amendment. I yield back.
Thank you. The gentlelady yields back, and I will recognize myself. So while I do share some of my colleagues' concerns around the out-of-pocket costs for prescription drugs, a sweeping commercial market mandate's not the best pathway forward. That's why we've included a number of Medicaid and Medicare PBM reforms in this bill. These PBM policies will lower drug prices for patients and improve our Medicaid system, just like we've been focused on doing throughout the process. I will say that it's kind of interesting that this bill asks for a $35 out-of-pocket when it's been argued that paying $35 max out of cost for Medicaid for people in the expanded Medicaid is not, one of those two things aren't considered as equivalent. But anyway, I'll urge my colleagues to oppose this amendment, and I'll yield back.
And just for clarification, that it's $35 for people on private insurance who will see other costs go up.
No further questions. The vote occurs on the amendment.
Nobody.
Roll call has been requested, and the clerk will call the roll.
Mr. Latta. Mr. Griffith. Mr. Bilirakis. Mr. Hudson. Mr. Carter. Mr. Palmer. Mr. Palmer votes no. Mr. Dunn. Mr. Crenshaw. Mr. Crenshaw votes no. Mr. Joyce. Mr. Joyce votes no. Mr. Weber. Mr. Weber votes no. Mr. Allen. Mr. Allen votes no. Mr. Balderson. Mr. Balderson votes no. Mr. Fulcher. Mr. Fulcher votes no. Mr. Pfluger. Ms. Harshbarger. Ms. Harshbarger votes no. Ms. Miller-Meeks. Ms. Kamick. Ms. Kamick votes no. Mr. Olbernolte. Mr. Olbernolte votes no. Mr. James. Mr. James votes no. Mr. Bentz. Mr. Bentz votes no. Ms. Houchin. Ms. Houchin votes no. Mr. Fry. Mr. Fry votes no. Ms. Lee. Ms. Lee votes no. Mr. Langworthy. Mr. Langworthy votes no. Mr. Kane. Mr. Kane votes no. Mr. Ruley. Mr. Ruley votes no. Mr. Evans. Mr. Goldman. Mr. Goldman votes no. Ms. Fedorchak. Ms. Fedorchak votes no. Mr. Pallone. Mr. Pallone votes aye. Ms. DeGette. Ms. DeGette votes aye. Ms. Schakowsky. Ms. Schakowsky votes aye. Ms. Matsui. Ms. Matsui votes aye. Ms. Castor. Ms. Castor votes aye. Mr. Tonko. Ms. Clark. Mr. Ruiz. Mr. Ruiz votes aye. Mr. Peters. Mr. Peters votes aye. Ms. Dingle. Ms. Dingle votes aye. Mr. Veazey. Mr. Veazey votes aye. Ms. Kelly. Ms. Kelly votes aye. Ms. Barragan. Ms. Barragan votes aye. Mr. Soto. Mr. Soto votes aye. Ms. Schreier. Ms. Schreier votes aye. Ms. Trahan. Ms. Trahan votes aye. Ms. Fletcher. Ms. Fletcher votes aye. Ms. Ocasio-Cortez. Ms. Ocasio-Cortez votes aye. Mr. Auchincloss. Mr. Auchincloss votes aye. Mr. Carter. Mr. Carter votes aye. Mr. Menendez. Mr. Menendez votes aye. Mr. Mullen. Mr. Mullen votes aye. Mr. Landsman. Mr. Landsman votes aye. Ms. McCullen. Ms. McCullen votes aye. Chairman Guthrie. Chairman Guthrie votes no.
How is Carter recorded?
Mr. Carter is not recorded.
Carter votes no.
Mr. Carter votes no. Mr. Latta is not recorded. No. Mr. Latta votes no. Mr. Griffith votes no. Mr. Bilirakis votes no. Mr. Hudson votes no. Mr. Dunn votes no.
You okay? The clerk will report the results.
Mr. Chairman, on that vote, there were 22 ayes and 27 noes.
The amendment is not agreed to. Are there further amendments? Chair recognizes the gentleman from New Jersey.
Thank you, Mr. Chairman. My amendment is titled Health FCD AMD 121 little XML.
The clerk will report the amendment.
Amendment offered by Mr. Pallone. At the end of the following, establishing,
Without objection, the reading of the amendment is dispensed with, and the gentleman is recognized for 5 minutes in support of the amendment.
Thank you, Mr. Chairman. My amendment will establish a $2,000 out-of-pocket cap on prescription drug costs for consumers with private health insurance. And this is part of a long-term Democratic effort to try to bring down costs and address affordability, which I keep stressing that the bill before us today does not do. Prescription drug prices are rising at an alarming pace, and the problem is widespread. Annual drug spending in the United States has reached $487 billion, and the U.S. spends more than other countries for prescription drugs. Consumers' out-of-pocket costs for prescription drugs has grown by 25% over the past 5 years, and in 2024, Americans spent $98 billion out of pocket on prescription drugs. This increase is having a very real impact on American families, with 1 out of 4 Americans unable to afford the cost of their prescriptions. According to a survey by the Kaiser Family Foundation, 30% of Americans say they haven't taken their medication as prescribed due to cost. And throughout the country, there's bipartisan support for action to lower the cost of prescription drugs and make treatments more affordable for patients and their families. Thanks to the Biden administration and congressional Democrats, we passed the Inflation Reduction Act, which helped lower the cost of prescription drugs for millions of seniors. The Inflation Reduction Act created the first ever annual cap on drug costs for seniors in Medicare, capped the cost of insulin at $35 per month, and granted Medicare the power to directly negotiate drug prices. It was a historic achievement that lifted restrictions that have been in place for nearly 20 years, preventing Medicare from negotiating drug prices. Unfortunately, Republicans today are working to undermine the IRA by blowing a hole in the IRA's negotiation rules to allow manufacturers to game negotiation and allow blockbuster drugs like Humira to stay off the negotiation list. And it's kind of shocking to me, since your own president claims he wants to lower drug prices with his executive order last week. But I guess this is one explanation, that Republicans want to benefit from suggesting or pretending they're going to lower prices because it's popular, but your actions show that we actually don't do that. You don't care about affordability. And I think that's clear today, because you're cutting Medicaid for low-income Americans. Now, here's what the Democrats stand for. My amendment builds upon the historic progress made by the Inflation Reduction Act to further lower drug prices for American families by capping out-of-pocket costs for those with private insurance. So in the same way that Dr. Schreier wanted to bring the insulin provision from the IRA with regard to insulin, I want to bring the provision with regard to the $2,000 cap for seniors in Medicare Part D over to the private insurance market, so that every American who has insurance can benefit from the $2,000 cap. And while my Republican colleagues are still pursuing the goal of, in my opinion, today of sabotaging the ACA with this budget reconciliation and taking away coverage from millions of Americans between Medicaid and the ACA, Democrats are committed to lowering health care prices for patients. The Medicare 2000 out-of-pocket cap has resulted in real savings for seniors, and we must expand this to all Americans with private market coverage so Americans are not forced to forego life-saving medication. The vast majority of Republican and Democratic voters all agree that one of the most important healthcare issues is making prescription drugs affordable for those that need them. So if that's what you believe in, then you should vote for this amendment, and I urge all my colleagues on both sides of the aisle to support this amendment. And with that, it looks like the gentleman from Massachusetts would like my last minute. I yield to the gentleman.
Thank you, Ranking Member. I just want to extend my appreciation for you introducing this because it really is an opportunity for both parties, actually, to demonstrate to American families that we're willing to fight health insurance corporations to lower their out-of-pocket costs. Because I can tell you right now, the only institutions in America that don't like this are United Health Group, Cigna, Express Scripts, and CVS Caremark. Everybody else thinks this is a great idea because everybody else understands that there is no moral hazard. There is no need for skin in the game when it comes to appropriately prescribed prescription drugs. When a doctor prescribes a drug to a patient, that patient needs it. They're not going to take more of it. They're not going to take less of it. They're going to take the appropriately prescribed amount of it. And so having an out-of-pocket cost to try to induce the patient to use less of it makes no sense. It's simply the insurance company trying to pass on the cost that they rightfully should bear, having been paid premiums every single month while that patient was healthy. And so we now have a clear-cut opportunity to say to American families, we think you should be paying less for prescription drugs, and to tell the health insurance companies that they cannot keep price gouging patients and pharmacists and taxpayers the way they have over the last decade. So I would expect that all parties can agree to this amendment. I yield back.
And I yield back, Mr. Chairman.
The gentleman yields. The chair now recognizes himself for 5 minutes. While I share the ranking member's concerns around the out-of-pocket costs for prescription drugs, this policy is not the best path forward. That's why we included bills that I had sponsored dealing with PBMs on Medicaid and Medicare, reform policies that are in this bill. Reform policies that would result in lower prescription drug costs, like eliminating spread pricing in Medicaid, where where PBMs charge one price and pay for much less than that. That kind of spread pricing will be eliminated in Medicaid and will result in significant savings for patients and for the federal government. These PBM policies will lower drug price for patients and improve our Medicaid system, just like we've been focused on doing throughout this process. Yes, prescription drug prices do need to come down. There's no question about that. Out-of-pocket costs need to come down. The savings that are being garnered now by the middlemen, by the PBMs, need to be passed on to the patients. That's the way we bring drug prices down. So I urge my colleagues to oppose this amendment because I do believe it is the wrong way for us to bring drug prices down, but I do applaud the ranking member's attempts to bring drug prices down, and I pledge to work with him to do just that. Anyone else want any time? Hearing none, I'll yield back. Are there any other members who want to speak on this bill? Hearing none. Okay. Hearing none, no further discussion. The vote occurs on the amendment. A recorded vote has been called for. The clerk will call the roll.
Mr. Latta. Mr. Griffith. Mr. Griffith votes no. Mr. Bilirakis. Mr. Bilirakis votes no. Mr. Hudson. Mr. Carter.
No.
Mr. Carter votes no. Mr. Palmer. Mr. Palmer votes no. Mr. Dunn. Mr. Dunn votes no. Mr. Crenshaw. Mr. Crenshaw votes no. Mr. Joyce. Mr. Joyce votes no. Mr. Weber. Mr. Weber votes no. Mr. Allen. Mr. Allen votes no. Mr. Balderson. Mr. Balderson votes no. Mr. Fulcher. Mr. Pfluger. Mr. Pfluger votes no. Ms. Harshbarger. Ms. Harshbarger votes no. Ms. Miller Meeks. Ms. Kamick. Ms. Kamick votes no. Mr. Obernolte. Mr. Obernolte votes no. Mr. James. Mr. James votes no. Mr. Benz. Mr. Benz votes no. Ms. Houchin. Ms. Houchin votes no. Mr. Fry. Mr. Fry votes no. Ms. Lee. Ms. Lee votes no. Mr. Langworthy. Mr. Langworthy votes no. Mr. Kane. Mr. Kane votes no. Mr. Ruley. Mr. Ruley votes no. Mr. Evans. Mr. Goldman. Mr. Goldman votes no. Ms. Fedorchak. Ms. Fedorchak votes no. Mr. Pallone. Mr. Pallone votes aye. Ms. DeGette. Ms. DeGette votes aye. Ms. Schakowsky. Ms. Schakowsky votes aye. Ms. Matsui. Ms. Matsui votes aye. Ms. Castor. Ms. Castor votes aye. Mr. Tonko.
Aye.
Mr. Tonko votes aye. Ms. Clark. Mr. Ruiz. Mr. Ruiz votes aye. Mr. Peters. Mr. Peters votes aye. Ms. Dingle. Ms. Dingle votes aye. Mr. Veazey. Mr. Veazey votes aye. Ms. Kelly. Ms. Kelly votes aye. Ms. Barragon. Ms. Barragon votes aye. Mr. Soto. Mr. Soto votes aye. Ms. Schreier. Ms. Schreier votes aye. Ms. Trahan. Ms. Trahan votes aye. Ms. Fletcher. Ms. Fletcher votes aye. Ms. Ocasio-Cortez. Ms. Ocasio-Cortez votes aye. Mr. Auchincloss. Mr. Auchincloss votes aye. Mr. Carter. Mr. Carter votes aye. Mr. Menendez. Mr. Menendez votes aye. Mr. Mullen. Mr. Mullen votes aye. Mr. Landsman. Mr. Landsman votes aye. Ms. McCullen. Ms. McCullen votes aye. Chairman Guthrie. Chairman Guthrie votes no. Mr. Latta is not recorded. Mr. Latta votes no. Mr. Hudson votes no. Mr. Fulcher votes no. Ms. Clark is not recorded.
I'm sorry, where? I can't see.
Ms. Clark votes aye.
I'm sorry, let me see. I don't think so. Clerk will report the results.
Mr. Chairman, on that vote, there were 24 ayes, 28 noes.
The amendment is not agreed to. Are there further amendments? The chair recognizes the gentleman from Florida.
To introduce an amendment, health-FCD-AMD_221.
Clerk will report the amendment.
Amendment offered by Mr. Soto. At the end of the following,
Without objection, the reading of the amendment is dispensed with, and the gentleman is recognized for 5 minutes in support of the amendment.
Thank you, Mr. Chairman. Perfect. You know, members, in 2022, in the Inflation Reduction Act, we were able to pass the ACA Enhancement Act, creating the premium tax credit. This made Obamacare more affordable to middle-class families, and we saw enrollment surge. 4.6 million Floridians get their health care through the Obamacare exchange. We have the largest exchange in the nation, primarily because we have a lot of people who work for small and mid-sized businesses that find it more economically efficient for them to get their health care on the exchange. In Florida's 9th Congressional District, we have the second most enrollment in the nation. In fact, all 5 of the top Obamacare enrollment districts are all in Florida, including 4 in South Florida. But coming up at the end of the year, this premium tax credit will lapse. And what that can mean is real increases in people's health insurance bills. Looking at the Kaiser Family Foundation, a couple in my district in their early 60s making about $100,000. Right now, they pay $8,500 a year with the premium tax credit for a silver plan. But without it, that'll go up to $18,000 a year, a nearly $10,000 increase. Take a median couple in my district making $78,000 a year with 2 kids. Their silver plan right now costs them $3,120. But without it, without the premium tax credit, it would go up to $20,000. We don't need to have a huge bill come due to so many of our constituents who are on Obamacare and who are getting private insurance through this public exchange. Now, I know this reconciliation package is the primary vehicle where this premium tax credit extension can happen. I recognize Ways and Means already had a vote on this, and it may be more proper in their committee, but I want to make sure we at least we're able to talk about it in this committee since it means so much to my constituents and so many others. And with that, I withdraw the amendment.
Gentleman withdraws the amendment. Are there any other amendments? Chair recognizes the gentlelady from New York.
Thank you, Mr. Chairman. I have an amendment at the desk labeled AMD 220.
Clerk will report the amendment.
Amendment offered by Ms. Ocasio-Cortez. At the end of the following section.
Without objection, reading of the amendment is dispensed, and the gentlelady is recognized for 5 minutes in support of her amendment.
Thank you, Mr. Chair. You know, for months, we have been hearing the Republican majority talk about addressing waste, fraud, and abuse in our healthcare systems and in government systems writ large. One of the things I have found interesting in the discussions around waste, fraud, and abuse is that it curiously omits corporate waste, corporate fraud, corporate profiteering, and corporate abuse of public tax dollars all the time. And whether it's the failed audits of the Pentagon that get glossed over, whether it is the immense, and we've seen this, you know, in plenty of oversight hearings on a bipartisan basis, contractors that are, defense contractors that are defrauding the public dime. But we have this in the healthcare space as well, particularly in the form of Medicare Advantage and what happens within Medicare Advantage. As you know, many people know, Medicare itself is a health insurance program run by the federal government that covers people over the age of 65 and some people with disabilities. But Medicare Advantage is not the same thing as Medicare. Medicare Advantage is for-profit insurance. Medicare is public insurance. And listen, Medicare Advantage plans can be popular at first. These insurance companies will make the health insurance plans look good because up front, when you're healthy and don't need to go to the doctor, it looks like you save a few bucks compared to Medicare. But then when you get sick, that's when the sky falls down. That's when costs skyrocket. And when you really need care, you either can't get it in Medicare Advantage or you have to pay so much more out of your own pocket on a program that's ostensibly supposed to be done with public dollars. And these Medicare Advantage programs, the reason it this unfolds in this way, is because they are run by for-profit insurance companies. Companies like Cigna, Humana, and United Healthcare. They will take public taxpayer dollars that are intended for caring for Medicare-eligible populations, and then they will take all of that money. They will make people look sicker than they are because there's an incentive to what is known as upcode, and then they pocket the difference because they will deny people the care that they need. Traditional Medicare, real Medicare, pays doctors and hospitals directly for the medical services they provide. Medicare Advantage is a middleman that denies people care, then upcodes them to make them to look sicker, and then they pocket all of that public money, they pocket the difference in their own profit to pay their CEOs and to yield shareholder profit. And then when people actually do need more care, private insurance companies under Medicare Advantage don't want to pay for it. And all of this adds up to private insurance companies under Medicare Advantage taking somewhere between $80 billion and $140 billion per year from the federal government that they then pocket in their own profits. That's a lot of your waste, fraud, and abuse margin right there. $80 to $140 billion per year. So my amendment today is a fusion of several Republican and Democratic-supported pieces of legislation. Today, I would like Representative Ruiz and myself are offering up the bipartisan No Upcode Act, originally presented by the Senate Health Committee Chair, Senator Cassidy of Louisiana, as an amendment to this bill. It will go after that $80 to $140 billion in corporate waste, fraud, and abuse, and then it will take that money back in what's being pocketed, and it will reinvest it in actual Medicare and health care for everyday Americans to get enhanced and better health care that they need and deserve. It will save American taxpayers an estimated $124 billion over 10 years. It is fiscally responsible. Those savings, instead of going to tax breaks for billionaires and corporations, will then be reinvested in Medicare. This reinvestment in funds, which is from a bipartisan policy championed by my colleagues, Representative Ruiz. In fact, we have a Republican representative who is also a co-sponsor on that bill, will ensure doctors are receiving adequate payment for the life-saving services that they provide, that our seniors and people with disabilities get the care that they need, and that profiteering companies no longer are getting away with this loophole. So I hope we can all agree on that. And I yield back.
Gentlelady yields. The chair now recognizes himself for 5 minutes. I rise in opposition to the amendment. While I recognize the spirit of the amendment and agree that we need to more closely examine the Medicare Advantage program, these policies would make structural changes to the Medicare Advantage program that warrant further discussion outside the scope of this markup. We're also fixing the broken Medicare physician fee schedule in the underlying bill, which is one of the most historic investments in the fee schedule in recent history. While I appreciate my Democratic colleagues' commitment to our physicians and seniors in Medicare, we should work together on these issues beyond reconciliation. And I urge my colleagues to therefore vote no on this amendment. Any other members looking to be recognized?
We're here.
I'll yield back. Recognize the gentleman from California.
Thank you, Mr. Chairman, and thank you, Representative Ocasio-Cortez, for bringing attention to this important issue and for your work to strengthen our nation's healthcare system, especially when so many here are trying to weaken it. My Republican colleagues keep talking about wanting to go after waste, fraud, and abuse, but so far all they seem interested in is going after working families' healthcare coverage. If you want to go after real fraud, there are appropriate channels to do so, and the appropriate channels does not include harming patients so that you can pay for tax cuts for the wealthy. As Ms. Ocasio-Cortez explained, this amendment would rein in real fraud in the healthcare system by cracking down on upcoding in Medicare Advantage. And instead of using the savings it would generate for the program to enrich a handful of billionaires and millionaires, this amendment would require that those savings are reinvested back into healthcare, into strengthening Medicare for patients and providers. Specifically, the savings will be reinvested to increase physician reimbursement in Medicare to address a pressing patient access issue This is from my bipartisan bill, the Strengthening Medicare for Patients and Providers Act, which ties physician reimbursements to the medical inflation rate, or the MEI, fully at 100%. For years, physicians have been experiencing cuts to their Medicare reimbursements, even while other Medicare providers have experienced increases for inflation. From 2001 to 2023, inflation-adjusted payments for physicians declined by 26%, even amid the rising cost of running a medical practice. The physician fee schedule is broken, and this has led some physicians to struggle to keep their practice doors open and turn away new Medicare patients. This needs to be resolved to ensure access to care. This amendment, tying reimbursements fully to inflation, would enable physicians to keep up with the rising cost of practicing medicine by tying the Medicare physician payment rate to the full Medicare Economic Index. The quote-unquote doc fix in the underlying bill is suboptimal. It is not a doc fix. It ties the first year to 75% of Medicaid, and then the subsequent years, only 10% of the MEI. I mean, 75% to the MEI. And so this is woefully underfunding the needs to address inflation. So we can't afford for more practices to close their doors or to take fewer Medicare patients because they can't afford to treat them. The Medicare physician fee schedule needs a permanent fix, not this temporary short-changed fix, which the Medicare provision in the reconciliation bill does not provide. So we can all agree that we need to strengthen the healthcare system, not weaken it. And I urge my colleagues to fully tie the reimbursements to the full MEI, not a partial fix, not a little itty-bitty 10% fix, not a subpar fix, not a lack of fix that's going to have physician groups coming here every year again to tie the fee schedule to the full MEI in order to fully take care of Medicare patients. With that, I thank you and I yield the remainder of my time.
The gentleman yields. Any other members looking to speak on this amendment? The chair recognizes the gentlelady from Washington.
Thank you, Mr. Chairman. I am enthusiastically supporting Representative Ocasio-Cortez's amendment. I mean, I could not agree more about the Medicare Advantage abuses of patients in the form of pre-authorizations and denials and delays and appeals and dragging their feet and not providing the care promised. And then there's the abuses of the federal government, which is the abuse of taxpayers, by padding the diagnoses for patients in order to make them look sicker, in order to be able to get more money from the federal government. I mean, they're taking more and they're paying less, and that is abuse and requires oversight. I will tell you that the doctors from both parties have met and talked about this. We're all outraged. We all want oversight hearings, and so I hope our committee can pursue that. And then, you know, we're also talking about the physician fee schedule, and it is wrong. I mean, over 30 years, physicians have essentially taken a 26% pay cut from Medicare. And that's not fair compensation. And it has meant that doctors retire early, their practices close, especially in rural areas. But here's the thing, this is not an adequate fix. It doesn't even balance for this year, and then it doesn't keep up with inflation. As my colleague, Dr. Ruiz just said, it only provides 10% of inflation, so like 0.3% on average. That's peanuts. Okay, let's add to that that when patients lose Medicaid, that means that those physicians are losing patients whose insurance pays. But, you know, we all went into medicine because we want to take care of our patients. It's not like we're going to leave them hanging. We're going to take care of them with no compensation. Let me tell you, that hurts physician compensation far more. And here we are in a committee hearing that wants to take Medicaid away from 13.7 million Americans. So I just want to say that to me, as a physician, it is unthinkable that you would try to put a really inadequate fix on the Medicare reimbursement rates for physicians and have that be on the backs of our most vulnerable patients. It doesn't make sense. I would call it morally bankrupt, and we should all support this amendment, and we should all support aggressive oversight of the abuses of Medicare Advantage. Thank you, and I yield back.
The gentlelady yields back. Are there any other members wanting to be recognized or speak on this amendment? Hearing none, the vote occurs on the amendment. A recorded vote has been requested. The clerk will call the roll.
Mr. Latta. Mr. Latta votes no. Mr. Griffith. Mr. Griffith votes no. Mr. Bilirakis. Mr. Hudson. Mr. Hudson votes no. Mr. Carter.
No.
Mr. Carter votes no. Mr. Palmer. Mr. Palmer votes no. Mr. Dunn. Mr. Dunn votes no. Mr. Crenshaw. Mr. Crenshaw votes no. Mr. Joyce. Mr. Weber. Mr. Weber votes no. Mr. Allen. Mr. Balderson. Mr. Balderson votes no. Mr. Fulcher. Mr. Fulcher votes no. Mr. Pfluger. Mr. Pfluger votes no. Ms. Harshbarger. Ms. Harshbarger votes no. Ms. Miller-Meeks. Ms. Kamick. Ms. Kamick votes no. Mr. Obernolte. Mr. Obernolte votes no. Mr. James. Mr. James votes no. Mr. Bentz. Mr. Bentz votes no. Ms. Houchin. Ms. Houchin votes no. Mr. Fry. Mr. Fry votes no. Ms. Lee. Ms. Lee votes no. Mr. Langworthy. Mr. Langworthy votes no. Mr. Woolley. Mr. Woolley votes no. Mr. Kane. Mr. Kane votes no. Mr. Evans. Mr. Evans votes no. Mr. Goldman. Mr. Goldman votes no. Ms. Fedorchak. Ms. Fedorchak votes no. Mr. Pallone.
Aye.
Mr. Pallone votes aye. Ms. DeGette. Ms. DeGette votes aye. Ms. Schakowsky. Ms. Schakowsky votes aye. Ms. Matsui. Ms. Matsui votes aye. Ms. Castor. Ms. Castor votes aye. Mr. Tonko.
Aye.
Mr. Tonko votes aye. Ms. Clark.
Aye.
Ms. Clark votes aye. Mr. Ruiz.
Aye.
Mr. Ruiz votes aye. Mr. Peters. Mr. Peters votes aye. Ms. Dingle. Ms. Dingle votes aye. Mr. Veazey. Mr. Veazey. Mr. Veazey votes aye. Ms. Kelly. Ms. Kelly votes aye. Ms. Barragon. Ms. Barragon votes aye. Mr. Soto. Mr. Soto votes aye. Ms. Schreier. Ms. Schreier votes aye. Ms. Trahan. Ms. Trahan votes aye. Ms. Fletcher. Ms. Fletcher votes aye. Ms. Ocasio-Cortez. Ms. Ocasio-Cortez votes aye. Mr. Auchincloss. Mr. Auchincloss votes aye. Mr. Carter. Mr. Carter votes aye. Mr. Menendez. Aye. Mr. Menendez votes aye. Mr. Mullen. Mr. Mullen votes aye. Mr. Landsman. Mr. Landsman votes aye. Ms. McClellan. Ms. McClellan votes aye. Chairman Guthrie. Chairman Guthrie votes no.
Bilirakis.
Mr. Bilirakis is not recorded. Mr. Bilirakis votes no.
Mr. Allen? How about Mr. Allen of Georgia?
Mr. Allen is not recorded. Mr. Allen votes no.
Anyone else on the Republican side seeking recognition? Seeing none. Any member of the Democrat side? The lady from New York, the gentlelady from New York, how's she recorded?
Oh, sorry, I thought we were talking about.
Oh, for amendment, okay, that'll be right next. All right, seeing none, the clerk will report.
Mr. Chairman, on that vote, there were 24 ayes and 28 noes.
The amendment is not agreed to. Are there any other amendments? It looks like we have one from the gentlelady from New York. Gentlelady's recognized. Oh, excuse me. For what purpose gentlelady from New York seek recognition?
I have an amendment at the desk labeled AMD 085.
The clerk will report.
Amendment offered by Ms. Ocasio-Cortez. In section 44121,
Without objection, the reading of the amendment is dispensed with, and the gentlelady from New York is recognized for 5 minutes in support of the amendment.
Thank you, Mr. Chair. I think continuing on the theme of corporate profiteering that we have going on here, I want to address some of the very concerning cuts and gutting of nursing home safety provisions in order to pay for these further tax cuts. Because across the country, for-profit and private equity-owned nursing homes are operating with skeleton crews and dramatically reducing quality of care for people who are in nursing homes in order to, again, pocket the difference. Staff in nursing homes often have to care for 30 residents at a time on their own. And it's not because nursing homes don't have the money. Nursing homes receive tens of billions of taxpayer dollars each year, and instead of investing in higher worker pay and better care, they often take that money and pocket the difference. There are cases of nursing home residents laying soiled in their beds for hours, being drugged or physically restrained, and suffering from pressure sores and falls because there are not enough staff to care for them. Many of these nursing homes just pay workers poverty wages, and they subject them to dangerous working conditions. Now, the nursing home industry will tell you that requiring a minimum number of nurses is too costly and that it's too burdensome. But what they are not telling you is how nursing homes funnel billions of dollars meant for patient care through other companies that they own. They are funneling right now $11 billion annually, to be exact. And they do this to make it look like they are less profitable than they really are, so that they can tell legislators like us that they don't have the money to hire more staff or pay them more or provide better care. And there doesn't appear to be much federal scrutiny over this. This amendment asks that the rule around safe staffing ratios be reinstated in any state for which there is an occurrence of an adverse event, including death or a temporary harm event that is due to inadequate staffing levels that would not have been permitted under the nursing home staffing rule. And with that, I yield back.
Gentlelady yields back. Is there further discussion on the amendment? The gentleman from Georgia, Mr. Carter, is recognized for 5 minutes.
Move to strike last word.
Gentleman's recognized.
Mr. Chairman, I rise in opposition to the amendment. I'd like to submit the following for the record. It's a study from ABT Associates and was commissioned by CMS to form the basis of the minimum staffing rule. So to be clear, this is not just some outside group's independent study. This is what the Biden administration paid for and used when writing the minimum staffing rule. The study found that for the nursing homes in the 25th quartile and the 50th percentile for safety and quality in this country, if you required staffing ratios like those that were finalized by the Biden administration, a whopping 1% of those lower performing nursing homes would see an increase in safety and quality. 1%. And that's not just theoretical analysis. Massachusetts actually tested this out. How did it turn out for Massachusetts? The report found that the impacts of the requirement on quality and safety were not statistically significant. So we're talking about, at best, a 1% increase in safety, and at worst, no increase in safety. Meanwhile, CMS estimates that 80% of all nursing homes are not able to meet the staffing ratio requirements, and the CBO expects that the rule will cost $22 billion. $22 billion. Now look, I support people getting the quality care they need and deserve, but the math just doesn't add up here. I've heard from nursing homes. In fact, my profession was in nursing homes. I was a nursing home pharmacist consultant for many, many years. I've heard from them, I've seen it myself about this rule, and I know you all have too. The cost of the rule simply does not add the value that they are already providing, and they're not at risk of closing. And to me, the threat of closure is the greatest cost of all. Nursing homes will close if this rule goes into effect. If that happens, more seniors will die if nursing homes close and they have nowhere to go for long-term care. More seniors will die in hospitals as they await to be discharged to a facility for post-acute care. This rule adds billions of dollars to the deficit and reduces access to essential long-term care. This amendment is nothing more than a politically motivated delay tactic. As we've discussed at length, the underlying bill would not change coverage for populations that are legally enrolled in Medicaid, like children, pregnant women, seniors, and people with disabilities. We are shifting the focus back to the populations that Medicaid was intended to serve. That's what we need to be doing. I urge my colleagues to oppose this amendment, and I yield back.
Gentleman yields back. The gentleman from New Jersey, the ranking member, is recognized for 5 minutes on the amendment.
I want to speak in favor of this amendment because it really pains me to think that we're going to repeal this nursing home rule. First of all, the bottom line is, look, nursing homes have made a lot of major strides. Some of you have heard me talk so many times about a long time ago now, in the 70s, when we had terrible nursing homes. We had fires in New Jersey, in my hometown, where people were killed in these fires because conditions, safety, health conditions were so bad. And I would suggest to you that the nursing homes have come a long way since then. But the bottom line is many states, including my state, have looked into the issue of staffing. And we realize that if you don't have adequate staffing for nurses and even for home health aides, although I don't think this rule covers it, it's just nurses, then you really run the risk of bad treatment, unhealthy situations, and it's unsafe. It's unsafe, it's unhealthy, whatever, unless you have an adequate staffing ratio. And what really bothers me, and I've said it before today, is that, here you have a situation where people are going to be kicked off Medicaid, millions. They're not going to be able, many of them, to go on and get coverage under the ACA. They're going to pay more, in many cases, to go see a doctor, $35, whatever. And at the same time, now you're going to say that the quality of services go down. It's going to be bad enough because if states can't can't get Medicaid, have all these people kicked off Medicaid, they're going to have less money, a lot of uncompensated care. Some may just, they may just raise premiums for people, but in other cases, they're just going to drop services, or the quality of services are going to go down. But this is the worst example of it because you're literally saying, we're going to get rid of this nurse staffing ratio. And I think you're saving like $22 billion over 10 years as part of this, or the life of this reconciliation. And that's why you're doing it. You're not doing it because you think that this is going to help nursing homes. I mean, you may think it does, but I think it's not accurate. It's just a savings to pay for tax cuts for billionaires and large corporations. And it shouldn't be at the expense of the people living in nursing homes. It just isn't right. Now, we can argue all day long and tomorrow. Well, hopefully we'll be done here fairly soon and we won't be here tomorrow. But my point is that, again, why are we just talking about numbers? Why are we just talking about how much we're going to save so we can pay for these tax cuts? We should be talking about the quality of service, the quality of health care, affordability for people that have to buy insurance or get insurance. That's what this should be about, and it's not. And it really scares me to think that the progress that we've made with nursing homes, with mostly good actors over the years, it's literally 50 years, if I can go back to the 70s, is now going to start to seriously erode because we don't have an adequate nurse staffing ratio. And if you say, well, we need more nurses, I wouldn't argue with that, but then we should have a better program to get more nurse slots. Not have to bring so many nurses from overseas, which is what we've been doing as well. We should be making it easier and less costly for people to go to nursing school, so we have more nurses. Now, I understand that's a long-term project, which I'd like to see, but everything that's being done here with this reconciliation is just so terrible. It's the opposite of what you say on the Republican side. It's making people lose their health insurance, pay more for health care and for insurance, and at the same, if they can get it, and then at the same time now reduce services and, you know, making it more difficult to have a safe and healthy environment in nursing homes. I think that our seniors deserve better. We should be looking at ways to improving the quality of care, not only at nursing homes and hospitals, and community health centers, providing more access, providing greater services. That's what the Democrats have been doing, you know, as long as we've been around here, when we were in the majority, and even when we weren't, trying to work with you on a bipartisan basis to improve health care. And this goes in the opposite direction. So I yield back, Mr. Chairman.
The gentleman yields back, and the chair recognizes Mr. Griffith for 5 minutes to speak on the gentleman from Virginia for 5 minutes to speak on the amendment.
Thank you very much, Mr. Chairman. My colleague, and I have no doubt that it is his opinion that we're just looking at the money. It's not what we're just looking at least not for me. What I worry about representing a large rural area in Virginia, which is 4 hours to start from DC, and another 4 to 4.5 hours to the other end of the district. What I worry about when the gentleman from Georgia talks about 80% of the nursing homes won't be able to meet these standards, I worry about losing a fair number of my rural nursing home facilities for people who don't want to leave the county that they've spent their whole life in, who don't want to go 45 minutes, an hour, 2 hours away because their friends and their neighbors and their church are right there. That's what I'm worried about. And that's why I really like us getting rid of the staffing standard. And if it wasn't a part of reconciliation, I'd be looking at an independent bill, because this is going to hurt the people it's intended to help. Now, I can't speak for, you know, when you get closer up here to Northern Virginia, and they may not be able to afford to be right in the heart of the wealthy areas in Northern Virginia, but you don't have to go too far out. They might be able to make it happen. I can't say one way or the other. But when I look at the data that we've seen and that the gentleman from Georgia mentioned, I have to worry about those nursing homes. Now, do we want to maybe come up with a comprehensive plan over years to come up with things where we are allowed to put, you know, have more staffing standards outside of the house that the children or the nieces and nephews live in? And that's authorized in Virginia, but Medicaid doesn't pay for that. Well, maybe we should be looking at that. But right now, I need to take care of the folks who are already in the nursing homes. And if we want to do something comprehensive later, Mr. Chairman, we can. But for right now, I think this amendment does harm. I don't think it intends to. I think it's intended to do good. But for my district, with the demographics of my district, with the rural lay of the land in my district, this amendment hurts the people in the 9th Congressional District of Virginia, and I urge everybody to help me out and vote no.
Gentleman yields back. Is anyone else? There's a lady from, did Michigan, you were gonna, the lady from Virginia? I think there's a lady from Michigan. You've raised your finger first, right?
Yeah.
Thank
And then
you.
I'll do Virginia next. A little lady from Michigan.
Look, I want us to finish by 1:30, so I'm going to try to be short, but I think residents deserve the best of care. And yet, chronic understaffing continues in nursing homes, and the elderly and disabled Americans living in nursing homes have suffered as a result. In fact, people have died. And we saw too many stories during COVID and coming out of it where people have died. Our long-term care system is broken. Caregiving is the foundation of our economy and allows for our work to be possible. I could read to you and would maybe ask if I could put into the record later comments that were submitted to CMS by workers and patients that, you know, rolled out of their beds and fell onto the floor and couldn't get anybody to answer. They weren't found until 5 a.m. One night, a friend was having symptoms of a heart attack. There was no aide to come and help them. A nursing aide talked about, I'm a shower aide, and there's only 2 of us against 95 residents. Hey, this isn't, we need to do something. Seniors deserve to live with dignity and respect. We have a nursing home, a caregiving crisis. My next amendment is also going to talk about that. And I think that we need to be thinking about how we protect seniors in our country. This is a 10-year savings, and how many people are going to die during those 10 years? So we got to work to get more caregivers. We've got to work to get more people in there, and we've got to address the problem. With that, I'll yield back.
Gentlelady yields back. The gentleman from, is there anybody on the Republican side? The gentlelady from Virginia is recognized for 5 minutes.
Thank you, Mr. Chair. I just want to bring back the faces of some of the people that are impacted by the lack of sufficient staffing in rehab facilities, long-term care facilities, nursing home facilities, and we've got to do something about it, not 10 years from now, because people are dying. You've heard story after story after story of Medicaid recipients here who want to care for family members at home and are struggling to do that. And again, I remind you, the exploding cost of Medicaid is because of long-term care and seniors who are going to end up in long-term care or rehab, or the disabled who are in these facilities. But this is what happens when you don't have sufficient staffing. Eddie Bernice Johnson, who was a member of the Science Committee last year, I was so proud to sit across from a portrait of her as the first Black woman to chair that committee, did not die because she had spinal surgery. She died because she sat in her own urine for God knows how long, got an infection, and the infection killed her. In my district, there is a rehab facility that's been in the news lately over issues like inadequate staffing leading to inadequate wound care. And it's not just nurses. It's the people who work there overnight and help care for the folks. And one woman, Cindy Wilson, a constituent of mine who's a caregiver for a veteran named John Hill, says she came to the facility and had concerns about her loved one. Quote, he was crying, he was upset, he wanted to get out of there so bad. I wanted the same for him because of the lack of care. Inspectors found that for multiple reasons, staff failed to maintain the call light in a position where residents could access it. And so many times when residents press the call light, nobody's there to come because they're understaffed and in other areas and can't get through them. So when my father, who after a bleeding metastatic brain tumor was in a rehab facility, I saw his mental health decline because of how often he is in his bed pressing the call button, waiting for somebody to take him to the bathroom, brush his teeth, do any of the things he was used to doing on his own. I watched the same happen to my mother when she had to go in memory care. We can keep kicking the can down the road all we want, but this is going to explode as a problem in our Medicaid, in our Medicare, and our private insurance, although most of these folks can be covered by Medicaid or Medicare, if we don't do something about it now. And if the problem is there's not enough people to fill these positions, let's address that. This bill does nothing to do that. Let's address the fact that many of these people who are caregivers in their own right don't make enough money to pay their own bills or take care of their own family. Maybe we need to do something about that. Maybe we need to incentivize worker pipeline programs to get more people in these jobs. Again, not just nurses, but the care partners and the people who are there overnight helping take people out of their own urine and feces. That's all we're asking for here. That is all we are asking for here. And if this bill doesn't do anything about it, we better not kick the can down the road 10 years. Because there will be a lot more Eddie Bernice Johnsons who we are mourning the indignity of how such a dignified woman left this earth. I yield back.
Gentlelady yields back. Is there any further discussion? Seeing none, if there's no further discussion, the vote occurs on the amendment. A roll call has been requested. The clerk will call the roll.
Mr. Latta. Mr. Latta votes no. Mr. Griffith. Mr. Griffith votes no. Mr. Bilirakis. Mr. Bilirakis votes no. Mr. Hudson. Mr. Hudson votes no. Mr. Carter. Mr. Carter votes no. Mr. Palmer. Mr. Palmer votes no. Mr. Dunn. Mr. Dunn votes no. Mr. Crenshaw. Mr. Crenshaw votes no. Mr. Joyce. Mr. Joyce votes no. Mr. Weber. Mr. Weber votes no. Mr. Allen. Mr. Balderson. Mr. Balderson votes no. Mr. Fulcher. Mr. Fulcher votes no. Mr. Pfluger. Mr. Pfluger votes no. Ms. Harshbarger. Ms. Harshbarger votes no. Ms. Miller Meeks. Ms. Miller Meeks votes no. Ms. Kamick. Mr. Olbernolte. Mr. Olbernolte votes no. Mr. James. Mr. James votes no. Mr. Bentz. Mr. Bentz votes no. Ms. Houchin. Ms. Houchin votes no. Mr. Fry. Mr. Fry votes no. Ms. Lee. Ms. Lee votes no. Mr. Langworthy. Mr. Langworthy votes no. Mr. Kane. Mr. Kane votes no. Mr. Ruley. Mr. Ruley votes no. Mr. Evans. Mr. Evans votes no. Mr. Goldman. Mr. Goldman votes no. Ms. Fedorchak. Ms. Fedorchak votes no. Mr. Pallone. Mr. Pallone votes aye. Ms. DeGette. Ms. DeGette votes aye. Ms. Schakowsky. Ms. Schakowsky votes aye. Ms. Matsui. Ms. Matsui votes aye. Ms. Castor. Ms. Castor votes aye. Mr. Tonko.
Aye.
Mr. Tonko votes aye. Ms. Clark. Ms. Clark votes aye. Mr. Ruiz. Mr. Ruiz votes aye. Mr. Peters. Mr. Peters votes aye. Ms. Dingle. Ms. Dingle votes aye. Mr. Veazey. Mr. Veazey votes aye. Ms. Kelly. Ms. Barragon. Ms. Barragon votes aye. Mr. Soto. Mr. Soto votes aye. Ms. Schreier. Ms. Schreier votes aye. Ms. Trahan. Ms. Trahan votes aye. Ms. Fletcher. Ms. Fletcher votes aye. Ms. Ocasio-Cortez. Ms. Ocasio-Cortez votes aye. Mr. Auchincloss. Mr. Auchincloss votes aye. Mr. Carter. Mr. Carter votes aye. Mr. Menendez. Mr. Menendez votes aye. Mr. Mullen. Mr. Mullen votes aye. Mr. Landsman. Mr. Landsman votes aye. Ms. McClellan. Ms. McClellan votes aye. Chairman Guthrie. Chairman Guthrie votes no. Mr. Allen is not recorded. Mr. Allen votes no.
Aye on our side. The clerk will report.
Mr. Chairman, on that vote, there were 23 ayes and 29 noes.
The amendment is not agreed to. Are there any other amendments? The gentlelady from Michigan, what purpose does she recognize?
Thank you, Mr. Chair. I have an amendment at the desk labeled House 228.
Does the desk have the amendment?
Can you repeat the number?
228, the HCBS. Right? That's one of them, right? The HB, yeah.
You have it.
Do you have it?
Will you repeat it again? Sorry, Ms. Dingle, would you?
Health 228, ensuring HCBS services.
We got the right number?
66,
Oh,
they
I'm sorry.
changed the number, sorry.
Okay. Route 66? That doesn't go to Detroit? I'm sorry, my
what they
mic's
tell
on,
me.
I apologize.
Amendment offered by Ms. Dingle. At the end of the
The clerk will
following,
report.
amendment offered by Ms. Dingle. At the end of the following new section,
Without objection, the reading of the amendment is dispensed with, and the gentlelady from Michigan is recognized for 5 minutes in support of the amendment.
Thank you, Mr. Chairman. My amendment, look, we all need to accept it. I accept it, and my colleagues over here. Long-term care is broken in this country, and you don't understand it until somebody you love is in it. And we are luckier than 99 and 9/10 of the people in this country. And when we can't make a broken, fractured system work, you know we got a problem. My amendment assures that home and community-based services would not be cut or reduced under current laws. This amendment matters because with the impending cut and changes we are seeing, we have to ensure that the law the Republicans are offering isn't going to make any patient's lives worse. This is an issue I've been fighting for since I first got myself into the long-term care system, taking care of a man that I loved, and I was lucky enough to be able to keep him at home, that he was able to stay at home and function and be there and get the support he wants. We know that the majority of elderly people and individuals with disabilities would prefer to receive care in their homes, where they can maintain an independent life and remain engaged in their communities. No one should have to sit for years on a waiting list to get the care that they deserve, and caregivers shouldn't have to live in poverty to do their critical work. In the past reconciliation bill, I fought to strengthen long-term care for nearly 1 million Americans on the HCB waiting list. You know, and the fact of the matter is, home care is cheaper than long-term care in an institution. We need to prioritize robust investments to improve our broken care system by clearing waiting lists, ensuring more people can access home care, strengthening wages, and giving support to home care workers. I had one home care worker that was working several jobs at the same time, working 7 days a week, and was still below the poverty line, and I paid a decent wage. My amendment would not impose stricter eligibility standards, methodologies, or procedures for HCBS programs and services than are in place, and preserve covered HCBS, including the services themselves and the amount and duration. Finally, it would also maintain HCBS provider payments at a rate no less than those in place as of April 1, 2025. Thank you, Mr. Chair, and I yield back.
Gentlelady yields back. The gentleman from Georgia seeks recognition to speak on the, he's recognized for 5 minutes to speak on the amendment.
Asked to strike the last word. Mr. Chairman, I appreciate my colleagues' interest in home and community-based services. Access to care for Medicaid beneficiaries like home and community-based services is linked to the cost of the program. This isn't just theoretical. HCBS services are optional for states to provide, so when waste, fraud, and abuse crowd out spending, our most vulnerable suffer. It's been kind of the theme of what we've been trying to say here. We're trying to save money through waste, fraud, and abuse so that we can save Medicaid, so that we can sustain it, so that we can stabilize it for future generations, for the most vulnerable in our society. So when waste, fraud, and abuse crowd out spending, our most vulnerable suffer. Our policies focus on reducing fraud and removing ineligible beneficiaries, ensuring able-bodied adults are engaging with their community, and ending coverage for people who do not, or who are in this country illegally. We have also been focused on restoring the integrity of federal state Medicaid financing through reform to provider taxes and directed payments. But we do this in a way that grandfathers in these changes. These aren't cuts to benefits or funding. By strengthening and sustaining the Medicaid program in these ways, states can devote more resources to home and community-based services in our nation's most vulnerable populations. Again, this is what we're trying to achieve here, to stabilize this, to secure it, to save it. And that's why I oppose this amendment, and I yield back.
Gentleman yields back. Is there anybody seeking to, the gentleman from Louisiana is recognized to speak on the amendment.
Thank you, Mr. Chairman. I move to strike the last word. I'm sorry. I want to thank my colleagues for offering this very, very important amendment. Under Republicans' budget reconciliation bill, this committee is being forced to make cuts to Medicaid that will hurt millions of children and adults with disabilities who rely on Medicaid's home and community-based services program. Republicans say these cuts won't impact people with disabilities, but that's exactly what they're doing. There's no way to protect people with disabilities from hundreds of billions of dollars in cuts to Medicaid. On over half of Medicaid spending goes toward people who are eligible for Medicaid because of old age or disability. In fact, people with Medicaid have disabilities qualify because of eligibility pathways like Medicaid expansion is established by the Affordable Care Act, not through disability pathways. Yet Republicans on the committee are falsely referring to this eligibility group as able-bodied, while spewing false narratives about fraud, waste, and abuse. Medicaid is the reason that people with disabilities can have access to home and community-based services that allow them to live in their homes and communities with the support they need, including bathing, medication management, and food preparation. In Louisiana, in my state, over 11,400 people are on the waiting list for Medicaid home and community-based services. Under this proposal, that number will continue to grow. Home and community-based services are exactly the type of services that no other payer typically covers and will be cut if Republicans gut Medicaid funding. Let's be clear. Let's be clear about this. These are people's lives. Mr. Chairman, I want to remind you that we were joined yesterday and again joined today. We have Connor and Katie here with us. Coy and Cooper hopefully are getting some rest, but we know that Connor's a trooper and Katie's a trooper, and we thank you for your courage. We will continue to fight for you and so many others that are similarly situated because we believe in you. And just know this, while Connor may not be able to fight for himself, he's got a fighting mom and a fighting dad and a fighting brother and a fighting members of Congress, at least on this side of the aisle. Hopefully we'll get more on the other side of the aisle to recognize that these cuts have faces and they matter. I yield back.
Thank you. The gentleman yields back. And the committee welcomes our guests today. So that, is there anybody seeking further recognition? Is there anybody seeking recognition on the bill? Standing on the Republican side, Mr. Pallone, the gentleman from New Jersey, the ranking member, is recognized for 5 minutes on the bill.
I just want to also indicate my support for this. I know that Ms. Dingell, or the gentlewoman from Michigan, I guess I should say, has been working on, home-based care or home-based services for a long time, as well as trying to find solutions for long-term care, so that it's not, you don't have to spend down, and, there's so many problems with being able to pay for nursing homes, the way it works where you have Medicare coverage and then you go on Medicaid after a month or so. But I do think that, if I listen to what the gentleman from Georgia said, Mr. Carter, the bottom line is that you're making the statement that, money should be available to the states, that whatever you're doing is not going to make all these cuts or make it possible for states to, to continue services. So I don't see any reason why you shouldn't say that a maintenance of effort with regard to these home-based services can't be mandated under this legislation. If in fact what you're saying is true, which is that you think the states will be able to continue to provide services because of the way you're handling the program. I doubt that, but if you say that that is true, then there's no reason not to provide some sort of maintenance of effort the way Ms. Tingle has described. And so I think this is an important amendment, and I would support it and ask everyone to support it on both sides of the aisle. Yield to Mr. Tonko.
Thank you, Mr. Pallone. I rise in support of this amendment. What we're dealing with in this bill through provisions like the provider tax and FMAP cuts to New York are a straightforward cut of hundreds of billions of dollars to states to run their Medicaid programs, a pure and simple cut. There's no amount of spin that can get you away from the fact that this bill would cut hundreds of billions of dollars out of state Medicaid programs. And despite what my colleagues say, there are no protections or guarantees that this massive cut won't harm care for those they deem to be the deserving Medicaid beneficiaries, those in nursing homes, pregnant moms, those with disabilities. That would include programs like home and community-based services. In the years to come, as states grapple with this massive cut that Republicans in this room have gifted them, they will have to respond in one of three ways: cutting Medicaid benefits, kicking people off the program altogether, or raising taxes. That's it. Those are the choices that our colleagues are going to force states to make. I'd be happy to yield to any of my colleagues who want to tell me which choice they would make. No takers? Didn't think so. When states have to make these massive cuts to their Medicaid programs, where do you think they're going to look first? To the most expensive patients, the elderly, the sick, and the disabled, and that's home community-based services. So I think, that the very people that my Republican colleagues claim they're trying to protect are those individuals I just listed. And so to my colleagues on the other side of the aisle, don't try to tell me that you're protecting Medicaid for those that deserve it. It's just not true. These impossible choices that you are forcing on states with this abomination of a bill will result in a worse system for everyone, and you will own that. And I urge all of my colleagues to support this amendment and stop the assault on Medicaid. And with that, Mr. Chair, I yield back.
The gentleman from New Jersey controls the time.
Yeah, I will yield back. I don't think anybody else wants my time, so I yield back.
Gentleman yields back. Is there any other seeking recognition? Seeing none, there's no further discussion. The vote occurs on the amendment. A roll call vote has been requested, and the clerk will call the roll.
Mr. Latta. Mr. Latta votes no. Mr. Griffith. Mr. Griffith votes no. Mr. Bilirakis. Mr. Bilirakis votes no. Mr. Hudson. Mr. Hudson votes no. Mr. Carter of Georgia. Mr. Carter of Georgia votes no. Mr. Palmer. Mr. Dunn. Mr. Dunn votes no. Mr. Crenshaw. Mr. Crenshaw votes no. Mr. Joyce. Mr. Joyce votes no. Mr. Weber. Mr. Weber votes no. Mr. Allen. Mr. Allen votes no. Mr. Balderson. Mr. Balderson votes no. Mr. Fulcher. Mr. Fulcher votes no. Mr. Pfluger. Mr. Pfluger votes no. Mrs. Harshbarger. Mrs. Harshbarger votes no. Mrs. Miller-Meeks. Mrs. Miller-Meeks votes no. Mrs. Kamick. Mrs. Kamick votes no. Mr. Obernolte. Mr. Obernolte votes no. Mr. James. Mr. James votes no. Mr. Bentz. Mr. Bentz votes no. Mrs. Houchin. Mr. Fry. Ms. Lee. Ms. Lee votes no. Mr. Langworthy. Mr. Langworthy votes no. Mr. Kane. Mr. Kane votes no. Mr. Rulli. Mr. Rulli votes no. Mr. Evans. Mr. Evans votes no. Mr. Goldman. Mr. Goldman votes no. Mrs. Fedorchak. Mrs. Fedorchak votes no. Mr. Pallone. Mr. Pallone votes aye. Ms. DeGette. Ms. DeGette votes aye. Ms. Schakowsky. Ms. Schakowsky votes aye. Ms. Matsui. Ms. Matsui votes aye. Ms. Castor. Ms. Castor votes aye. Mr. Tonko.
Aye.
Mr. Tonko votes aye. Ms. Clark.
Aye.
Ms. Clark votes aye. Mr. Ruiz. Mr. Ruiz votes aye. Mr. Peters. Mr. Peters votes aye. Mrs. Dingle. Mrs. Dingle votes aye. Mr. Veazey. Mr. Veazey votes aye. Ms. Kelly. Ms. Kelly votes aye. Ms. Barragan. Ms. Barragan votes aye. Mr. Soto. Mr. Soto votes aye. Ms. Schreier. Ms. Schreier votes aye. Ms. Trahan. Ms. Trahan votes aye. Ms. Fletcher. Ms. Fletcher votes aye. Ms. Ocasio-Cortez. Ms. Ocasio-Cortez votes aye. Mr. Auchincloss. Mr. Auchincloss votes aye. Mr. Carter of Louisiana. Mr. Carter of Louisiana votes aye. Mr. Menendez. Mr. Menendez votes aye. Mr. Mullen. Mr. Mullen votes aye. Mr. Landsman. Mr. Landsman votes aye. Ms. McClellan. Ms. McClellan votes aye. Chairman Guthrie. Chairman Guthrie votes no.
One seeking recognition for the gentleman from Alabama.
Mr. Palmer is not recorded. Mr. Palmer votes no.
Okay, anyone else on the Democrat side that hasn't called the order? Seeing none, the clerk will report.
Chairman Guthrie, on that vote, there were 24 ayes and 28 noes.
The amendment is not agreed to. Are there any other amendments?
Mr. Chairman, I have an amendment at the desk.
The gentleman is recognized. Chairman has a amendment. He has an amendment.
It's-
Will you state the amendment?
It is Health FCD AMD number 212.
The clerk will report.
Health FCD dash.
Without objection, the reading of the amendment is dispensed with, and the gentleman is recognized for 5 minutes in support of the amendment.
Mr. Chairman, the amendment would require the Congressional Budget Office to certify that this bill will not worsen consumer medical debt before going into effect. Medical debt can be a crushing financial burden on American families, with dire consequences financially, emotionally, and mentally. Families with lower incomes, the disabled, and those with chronic medical conditions are the most likely to experience medical debt, but medical debt can affect everyone, even the relatively healthy and the insured. Major illnesses and accidents can cause medical bills to pile up quicker than folks can imagine. According to the Consumer Financial Protection Bureau, 100 million Americans owe $220 billion in medical debt. And according to another survey, 66.5% of all bankruptcies had a medical cause. According to the Kaiser Family Foundation, approximately 20.4 million Americans had medical debt in 2021. Out of the 20 million who owe medical debt, about 11 million owe more than $2,000. Thanks to the Affordable Care Act and the expansion subsidies included in the Inflation Reduction Act, more Americans have health coverage today than ever before. Studies show that the ACA is making a real difference. According to one study published by the National Bureau of Economic Research, the ACA has reduced medical debt among Medicaid expansion enrollees by about $600 to $1,000 per year. These reductions in medical debt make it more likely that Americans can get the care that they need when they need it. The ACA is having a real impact in reducing the burden of medical debt on American families. But we still need to do more. Even with the ACA, too many families are continuing to struggle with the financial burden of medical care, and high healthcare costs and affordability continue to be a challenge for consumers. This is creating a significant financial burden and preventing some families from getting the necessary medical care. More than 40% of American adults say they have either delayed or foregone medical care because of high costs, and half of adults have reported difficulty affording health care. Unfortunately, this bill moves us in the wrong direction and rips health coverage from millions of Americans. It takes away coverage from individuals enrolled in Medicaid and the ACA, which has helped low-income families reduce their medical debt. It reduces financial assistance for working American families to purchase health insurance. It makes health coverage more expensive for all Americans, and it will increase the ranks of the uninsured, resulting in more families struggling with medical debt. And it makes coverage less generous and raises out-of-pocket costs, which will result in more Americans ending up in bankruptcy court and more people going into medical debt. So what is particularly galling is that while many low and middle income Americans will be facing skyrocketing costs and possibly bankruptcy court, this bill provides tax breaks for the wealthiest individuals and corporations. If this bill passes, less people will have health coverage and be at a higher risk of experiencing medical debt. This bill is a bad deal for working American families. It will make us sicker and less economically secure. And I urge my colleagues to vote for this important amendment. Thank you, and I yield back the rest of my time.
Is there further discussion on the amendment? Well, if there's further discussion, we're gonna probably have to recess and come back after vote, so. Okay, so yeah, so since there is further discussion, I thought there weren't any, we could go ahead and vote this, but since there's further discussion, the committee will stand in recess until 15 minutes after the last vote on the floor is called. The committee is in recess.
That's what we do. That's what we do in all Congress.
Committee will come to order. I believe where we left, we were on the amendments, and the gentleman from New Jersey, the ranking member, was about to be recognized to speak, and so the gentleman is recognized.
Thank you, Mr. Chairman. I just wanted to say that I do think that this amendment by Dr. Ruiz about or the gentleman from California about a medical debt is important. You know, you've heard me speak over the last 24 hours or so about the issue of affordability and my concern that the Reconciliation Act that's before us today will actually increase costs for many Americans. Either they, lose their health insurance and they have to pay more for that if they can even get it, or they have to have co-pays when they go see a doctor. We talked about the nursing homes, but in the middle of all this is the issue of medical debt, which hasn't got, I think, as much attention in this committee and in the House as it should, because the consequence, of course, of things becoming less affordable and not having health insurance is that you rack up whatever the word is, medical debt, and people can't pay the deductibles, they can't pay the co-insurance, or they have no insurance and they just go to the emergency room and then they get a bill. Many people don't pay it, but it still goes down as medical debt. And I just think that the effort to reduce medical debt, to try to erase medical debt if possible, all that is really important in the context of the issue of affordability. And actually, Dr. Ruiz mentioned specifically the Consumer Financial Protection Bureau and the report that they put out. And I would point out that, the president's efforts to essentially abide, if you remember the gentleman from Illinois, Mr. Jakowski, we were there that day across from the White House because all the people that worked at the agency or at the Bureau were actually giving pink slips and were told not to come to work. And so I only highlight that again because that was an agency that actually was trying to avoid the medical debt problem and actually did a report, if I'm not mistaken, Dr. Ruiz, about the problem with medical debt that you cited. And now we don't even have that, right? Or maybe we do in some form, but it seems to be crippled to a large extent. So I think this amendment, which basically basically says that this title shall not go into effect if it has the effect of increasing medical debt for consumers, should be supported by all of us. The Republicans say that there's not going to be increased costs and the people are not going to be kicked off their health insurance. I don't believe that. But if they do believe it, again, why not say that we're not going to let this title go into effect if it has the effect of increasing medical debt, because that's a major problem for so many people. And with that, unless someone else wants my time, I'll yield back the balance of my time.
Is there further discussion on the amendment? Seeing none. And your roll call's been asked for. No further discussion. The vote occurs on the amendment. The roll call has been requested, and the clerk will call the roll.
Mr. Latta? Mr. Latta votes no. Mr. Griffith?
I will vote no.
Mr. Griffith votes no. Mr. Bilirakis? Mr. Bilirakis votes no. Mr. Hudson? Mr. Carter of Georgia? Mr. Carter of Georgia votes no. Mr. Palmer? Mr. Dunn? Mr. Dunn votes no. Mr. Crenshaw? Mr. Crenshaw votes no. Mr. Joyce? Mr. Weber? Mr. Weber votes no. Mr. Allen? Mr. Balderson? Mr. Balderson votes no. Mr. Fulcher? Mr. Fulcher votes no. Mr. Pfluger? Mr. Pfluger votes no. Mrs. Harshbarger? Mrs. Miller Meeks? Mrs. Miller Meeks votes no. Mrs. Kamick? Mrs. Kamick votes no. Mr. Obernolte? Mr. Obernolte votes no. Mr. James? Mr. Bentz? Mr. Bentz votes no. Mrs. Houchin? Mr. Fry? Mr. Fry votes no. Ms. Lee? Ms. Lee votes no. Mr. Langworthy? Mr. Langworthy votes no. Mr. Kane? Mr. Kane votes no. Mr. Rulli? Mr. Rulli votes no. Mr. Evans? Mr. Goldman? Mr. Goldman votes no. Mrs. Fedorchak? Mrs. Fedorchak votes no. Mr. Pallone? Mr. Pallone votes aye. Ms. DeGette? Ms. DeGette votes aye. Ms. Schakowsky? Ms. Schakowsky votes aye. Ms. Matsui? Ms. Matsui votes aye. Ms. Castor? Ms. Castor votes aye. Mr. Tonko?
Aye.
Mr. Tonko votes aye. Ms. Clark?
Aye.
Ms. Clark votes aye. Mr. Ruiz?
Aye.
Mr. Ruiz votes aye. Mr. Peters? Mr. Peters votes aye. Mrs. Dingle? Mrs. Dingle votes aye. Mr. Veazey? Aye. Mr. Veazey votes aye. Ms. Kelly? Ms. Kelly votes aye. Ms. Barragan? Ms. Barragan votes aye. Mr. Soto? Mr. Soto votes aye. Ms. Schreier? Ms. Schreier votes aye. Ms. Strahan? Ms. Strahan votes aye. Ms. Fletcher? Ms. Fletcher? Ms. Fletcher votes aye. Ms. Ocasio-Cortez? Aye. Ms. Ocasio-Cortez votes aye. Mr. Auchincloss? Mr. Auchincloss votes aye. Mr. Carter of Louisiana? Mr. Carter of Louisiana votes aye. Mr. Menendez? Mr. Menendez votes aye. Mr. Mullen? Mr. Mullen votes aye. Mr. Landsman? Mr. Landsman votes aye. Ms. McClellan? Ms. McClellan votes aye. Chairman Guthrie?
No.
Chairman Guthrie votes no.
How's Mr. Allen recorded?
Mr. Allen is not recorded.
Dr.
Mr. Allen
Joyce?
votes no. Dr. Joyce is not recorded.
Ms.
Joyce
Houchin?
votes no.
Ms. Houchin?
Mrs. Houchin is not recorded.
Mr. Chairman, House James recorded.
Houchin votes no.
Mr. James?
Mr. James.
Mr. James votes no.
Mr. James votes no.
On the Democrat side? Oh, Ms. Harshberger, how's she recorded?
Mrs. Harshbarger is not recorded. Mrs. Harshbarger votes no.
Yes, she did. How's Ms. Houchin recorded?
Mrs. Houchin is recorded as no.
Okay. Is anyone on the Democrat side here? Everybody was, yeah, we're all in your places. So the clerk will call the roll.
Chairman Guthrie, on that vote, there were 24 ayes and 27 noes.
The agreement is not, the amendment is not agreement. The amendment is not agreed to. So are there, what purpose does the gentlelady from Florida seek recognition?
I have an amendment at the desk. It is Health FCD AMD 126.
The clerk will report.
Mr. Chairman, could the gentlelady please repeat the amendment?
126.
Thank you.
The clerk will
Health
report.
dash FCD dash AMD underscore.
Without objection, the reading of the amendment is dispensed with, and the gentlelady is recognized for 5 minutes in support of the amendment.
Well, thank you, Mr. Chairman. This amendment says that none of the provisions of this title shall take effect if any of the provisions result in reduced access to coverage under the health title. And as we bring this debate in for a landing today, I want to say to my Democratic colleagues, I'm so proud to stand with you. You're eloquent and fearless. And to Chairman Guthrie and my Republican colleagues, I want to thank you. I appreciate your respectful tenor of the debate. But we've learned a lot since the Republicans sprung this cruel and costly tax and spending package on Americans late in the dark of night, on Mother's Day no less, rushing it to committee without a hearing, shrouding the health care debate, starting that at 1 a.m. in the middle of the night. But here's what we know. Almost 14 million Americans will lose their health coverage to give the richest Americans a large permanent tax cut, while working families will see eventual tax increases. They're going to add $5 trillion to the debt. It's fiscally irresponsible and it is morally wrong. 14 million Americans. That's the combined population of the states of Kentucky and Virginia. Some of the largest health care cuts ever proposed in American history, harming not just our neighbors, but providers, doctors, nurses, hospitals, therapists who provide care. So this is going to impact all Americans. Here's how. They're going to bury people in costly paperwork. You slip up, no care. They're going to make it harder to enroll, no care. They're going to shrink the enrollment periods, no care. They're going to choke off the ability of states and providers to fund care. So no care there either. They're going to raise premiums and price people out so they lose care. Eligible parents and families will be forced to jump through hoops when instead they should be focused on setting their kids up for success in life. It will be harder for families to access long-term care or stay in their homes and live in dignity. Now, at the outset of our hearing that began over 24 hours ago, the Democrats highlighted folks back home who rely on Medicare or Medicaid. And the Republicans protested. They said none of those people are going to lose their health care. Well, here's what we know. The nonpartisan independent CBO says 14 million Americans will lose care. And why won't people believe what the Republicans are saying? It's because the Republicans have a track record of opposing affordable health care. While Democrats have championed the health of our neighbors, we do not believe that you should be bankrupt if you get a diagnosis. This is smart policy. We want people to be productive and healthy. In fact, you can go all the way back to the 1960s when it was a Democratic president and a Democratic Congress who originally passed Medicaid and Medicare into law, or maybe something more in the modern era. 2010, when a Democratic president and a Democratic Congress, as the rolls of the uninsured reached 25% in the state of Florida, we passed the Affordable Care Act to outlaw discrimination for pre-existing conditions. We passed a law that said kids can stay on their parents' plan till age 26. We expanded Medicaid. 21 million Americans now have health coverage because of Medicaid expansion. That ultimately cut the uninsured rate in half. We're now at a historic low in the number of uninsured. We were constraining spending. But see, the Republicans have a track record because they fought it every step of the way. There wasn't one Republican vote for the Affordable Care Act. And then go to 2017, the first Trump administration. Republicans in this committee fought to repeal the ACA. Contrast that to the Democratic record. We passed the Inflation Reduction Act, key reforms to lower health care costs, direct Medicare to negotiate prices for the highest cost drugs. We capped the price of insulin at $35, a $2,000 cap for everyone on Medicare, and enhanced premium tax credits. The track record again, not one GOP vote here. In 2021, in the midst of a maternal mortality crisis, we gave states a new option to provide Medicaid, postpartum coverage. In 2025, now here at the outset of this Congress, the Republicans are turning a blind eye. They're going down the same old path to rip health coverage away. It doesn't have to be like this. People in America deserve affordable, reliable care. And that's what we intend to fight for. From this day forward, no matter if you pass this bill out of this committee, we're not going to give up. We're going to stand up for our neighbors back home. See them, listen to them, empower them, support them. Don't rip away their coverage to fund a massive tax giveaway for the
The
wealthiest.
gentlelady's time has expired.
I yield back my time.
The gentlelady yields back. The chair will now recognize himself to speak on the amendment. So the American people need to know what my Democrat colleagues are prioritizing. When they say they're against any coverage loss, what they're really saying is 4.88 million people who refuse to work, a part-time job, or volunteer in their communities are entitled to free health care paid for by hardworking taxpayers. When they're saying against any coverage loss, what they're really saying is that the 1.4 million illegals who are a drain on our healthcare system should be prioritized over U.S. citizens. And when they say they're against coverage loss, what they're really saying is that people who aren't actually eligible for Medicaid should be prioritized over children, mothers, or people with disabilities who this program was designed for. Let's be honest about who we're fighting for here today. House Republicans are fighting for America's children. We're fighting for pregnant women and mothers. We're fighting for individuals with disabilities. And we're fighting for the seniors who need long-term care. We believe this is who Medicaid is intended for, not illegal immigrants, not able-bodied adults who choose not to work, not people fraudulently enrolled. We want to root out the waste, fraud, and abuse in the system and make Medicaid stronger and more secure for generations to come. And I will yield back, and we'll recognize the ranking member for 5 minutes to speak on the amendment.
Thank you, Mr. Chairman. Mr. Chairman, I think there's a fundamental disagreement here about what this bill does. It's clear to me that, contrary to what you say, this is very much like the Georgia situation. And that is that you have a group of people, in the case of Georgia, I think it was about 400,000 Georgians, and you had something like 5,000 of them that ended up being covered by Medicaid with all this red tape that you put forth in this bill. Now you say, well, only those 4,000, probably were eligible. And I would say no. I think the 400,000 were eligible. But the problem was you put so many roadblocks in their way, or not in this case, in the case of Georgia, put so many roadblocks in their way and spent so much of an effort not on providing them health care, but rather on making sure that they weren't able to get health care. Now, I'm not trying to say there's anything intentional here. I don't want you to get the wrong impression. The fact of the matter is that if you put together a system, which is in this bill, where people have to constantly face all kinds of red tape in order to, get their health insurance under Medicaid, to the tune of having to file papers every month if the state decides to do that, and then say, oh, don't worry, there are all these exceptions. If you're pregnant, you're an exception. If you're disabled, you're an exception. But again, it goes back to the situation like that in Georgia where people couldn't qualify. They couldn't show that they qualified for these exemptions. So either you miss the actual initial test of whether or not you filed the paper to show that you're eligible, or you missed the test of showing that you're exempt and didn't have to file the paper, but you had to file more paper for that. It ends up that less than 5% of the people that are actually eligible end up getting on Medicaid. Everyone else is thrown off. And you can talk about the undocumented and the people that are in 2 different states and all that, but I think we've showed rather dramatically that that's a very small number overall compared to this 13.7 million that the CBO says is actually going to lose their health insurance. And that's not only because of the 8.5 million or so that would clearly lose their health insurance under this bill, but also because of another 5 who will lose it because they'll lose the subsidy because you're not renewing it for the ACA. So if you think that 13.7 or 8.5 million people are not eligible, I mean, you can think that, but I think it's a fiction. The reality is that you're making it so that people who would normally be eligible are not. And then in addition to that, you have all kinds of other things that make this system, even more unaffordable, causing people to pay, in certain categories, to pay $35 a month. $35 each time they go to the doctor. Or in the case of nursing homes, reducing the quality of care because you get rid of the nurse staffing rule. There's all these little things that they add up to this almost $1 trillion, of which, over 700 billion of that is for healthcare alone. I'm not even getting into the environmental issues and the energy issues and the spectrum issues and other things that we talked about today, because I think the main thrust of this is that you are making it almost impossible for most of the people, for a significant number of the people who would be eligible for Medicaid, to actually receive it. And that's not fair. I don't think it's fair to suggest that, that there's any reason for this other than the fact that you're trying to save money in order to pay for these tax cuts for the very wealthy and for large corporate interests. And we as Democrats believe that we should be expanding health insurance and health opportunities. Now, I just want to thank, if I can, all of the people who have stayed with us all night fighting for their health care and the health care of their families and neighbors. I do believe the voices of the people in the audience are powerful, and Democrats will do everything that we can to protect your health care, and we will win this fight. And lastly, Mr. Chairman, if I could say, we have about 200+ letters expressing opposition or concern with this Republican bill, representing thousands of organizations, and I would ask that that be entered into the record. I'm not going to throw this book at you, but
I don't see any,
get it to the,
throw the book at me. I don't see any objection.
and I yield back. Thank
Gentleman
you.
yields back. Are there any others seeking recognition? You ready? The gentleman from Texas seeks recognition to speak on the amendment.
Thank you, Mr. Chairman. I move to strike the last word. I want to commend you on running a great hearing and running a great markup and running a great reconciliation bill. I'm very proud of the work we've done here. There's a specific provision in this bill that I'm particularly proud of. I've been fighting for this for a long time. And I noticed that there's actually no amendments to strike it, which makes me maybe idealistically or foolishly think that we all agree on it. Maybe that's the case now, but this is the provision that ends the use of Medicaid, CHIP, and Affordable Care Act dollars for gender transition procedures on minors. This will become law, and I couldn't be happier about it. And gender transition procedures are the lobotomy of our generation. People look back on this period, I think, with disbelief, and I guarantee it. That gender-affirming care, it's not health care, it's fringe science with no proven benefit and enormous risks. And Americans agree with us, by the way, hence maybe the lack of amendments to strike it, because poll after poll shows overwhelming opposition to giving kids drugs or surgical interventions. And it should also be stated very clearly, the following provision has a direct budgetary effect since it amends the list of payment prohibitions under Section 1903I of the Social Security Act. It limits medically unnecessary procedures, which is exactly what gender transition procedures are. People wonder how we got to this place to begin with. Started in sociology departments, went to med schools, flooded our institutions like the American Academy of Pediatrics, finally landed in children's hospitals. Even though the most recent studies and systematic reviews have effectively debunked this foolish practice, it continues on. A Reuters investigation showed prescriptions for puberty blockers and cross-sex hormones have risen by over 120% in just a few years. This is a textbook social contagion. The truth is that many of these kids are wrestling with issues that kids wrestle with. They have comorbid psychiatric diagnoses. They have fleeting ideations, peer pressure, online echo chambers. It's not a condition that demands a prescription and a scalpel. But instead of asking why that's happening or why it especially affects young girls, we're told to just affirm and fast track. No questions asked. Parents need to shut up and do what the crazy doctor says. That's not care, that's malpractice, and the science doesn't support it. In 2024, the UK commissioned the CAS Review, an independent audit by top pediatricians of more than 100 studies on gender transitions for minors. Its verdict? Evidence for puberty blockers, cross-sex hormones, and surgeries is weak at best, and doctors can't predict which children will even continue to experience gender dysphoria. There's no conclusions on whether these treatments improve psychiatric conditions or prevent suicide. Worse, only 2 of those 100 studies even met the basic research standards one would expect. They lacked randomized control, they had poor follow-up rates, used sample populations that weren't minors, chemically castrate child sex predators, but hey, let's give it to a child because they tell a doctor they're in the wrong body? Now, thankfully, the Trump administration has published its own initial systematic review. HHS is doing that and found, again, no evidence of benefits. No surprise there. Here's the conclusion. When the science is this weak, the only ethical answer for us is first, do no harm. We're supposed to protect the kids, full stop. Our peer nations have already pivoted. We're catching up, and we're making permanent policy. That's thanks to President Trump, and that's thanks to what we're doing today. And I don't think this debate is about compassion versus cruelty. I really don't. I think it's just about medical ethics, safeguarding children, and demanding that real science and not activism guides our public health. I could not be more proud that we are finally taking action. And I yield back.
Gentleman yields back. Seeing, I had the gentlelady from California, from Los Angeles, the gentlelady from California. I'll say that Buttergon next, and then Ms. Matsui. She already asked for recognition. So, all right, thank you.
Thank you, Mr. Chairman. I'm not going to respond to all the gibberish I heard, but I will respond to a few. I heard safeguarding children. First, do no harm. That's exactly what House Democrats are trying to do by fighting against these Medicaid cuts. I will remind everybody, when there were amendments to protect kids getting access to health care, every single one of them, including the person who just said this, voted no. And having a chance to protect kids, and having a chance to protect the most vulnerable, and having a chance to do no harm, my colleagues across the aisle have shown that they are not interested. So to hear that is quite laughable and unbelievable. And my colleague from Florida did a great job of outlining why Republicans can't be trusted. The history of not even supporting the Affordable Care Act, to trying to repeal it, to now kicking millions of people off of Medicaid. They want to use the word shifting people off. Whatever word salad word you want to use, millions of Americans are going to lose their health care coverage because of this bill, which they are, by the way, proud of. And remember that. If you lose your coverage, when you lose your coverage because of this, that they ended today and said that they were proud of it. Now, why, well, the other thing my colleague, was she did her outline of why Republicans can't be trusted. Y'all remember the hearings and the budget resolution we had in this committee? Do you remember what my Republican colleagues said? They said the word Medicaid doesn't even appear in the text. This is not about Medicaid. We are not going to touch Medicaid. You remember those ridiculous allegations that were made then? That's why they can't be trusted. Because here we are, after a 25-hour hearing, they refused to have the health care conversation in the day of light. They waited until 2 o'clock in the morning to do it, and they did a total 180. So why can't they be trusted? Because they themselves said months ago during the budget resolution conversation, the word Medicaid wasn't even in the resolution. They were not going to touch it. Yeah, we just saw a chart by the chair showing how many millions of people they're going to kick off. It's not a totally accurate chart. It's missing a whole other chunk of 5 million people they want to throw off that are getting the Affordable Care Act, because this is their way of attacking the Affordable Care Act. So let's just remember why they can't be trusted. Let's remember their own words, and actions matter.